If you're just tuning in, we're joined by Dr. Larry Balle, a renowned sports medicine expert and regenerative therapy pioneer, really. He's helped Olympians, professional athletes, and active adults heal without surgery in some cutting-edge treatments. And we're going to dive into some little different questions right now without giving away any private details, because I know you can't really say names. Can you tell us about one of the Olympic medalists from Paris that you worked with and kind of how that role with PRP therapy helped?
Sure. So I had a little over 20 Olympians in Paris, a few different sports that were competing. One that comes to mind was having a nerve issue, and we discussed options. Again, like I mentioned previously, I was that second, third opinion that patient had, and we talked about some options. And that patient was told, or the athlete was told, you likely need surgery, but you can't really have surgery right before you go to the Olympics, obviously, right? And you're going to be out. So we talked about a couple different options, and we talked about a couple diagnostic options to then confirm that doing something in the orthobiologic realm was actually worth pursuing or worth spending that cash price option that we were talking about. And I did what's called a perineural ultrasound guided injection with a diagnostic. The athlete had benefit from that. And so we knew from there that was a subjective example of how they would likely benefit, therefore, from an orthobiologic product. And I used platelet-poor plasma around that nerve that was irritated, and it ended up being a couple nerves at the end of the day. One got better, and there was one that was still kind of lingering. So we ended up going after a couple nerves, and that Olympian ended up medaling at the Olympics. So they did great, they did well, and then postseason they were actually able to rest. Still haven't had surgery, but that was an example of a patient who was told that that was their only option, or not compete. And we changed it, and
I started thinking, the difference between an Olympic athlete or a very high elite athlete and your weekend warrior, or your just your mom or dad that are trying to work out, is the process any different between the two?
No, not at all. I mean, really, it's just the field that they step on or the activity, realm that they're in. But same mindset, same level of wanting to get back to doing whatever they're doing, and literally the same injury. I've done that procedure that I just mentioned on, a high school level athlete. I've done that procedure on the dad who, is an attorney and is sitting at a computer and having the same kind of, nerve issue. So, no.
Well, I mean, I remember, I can think back to my coaching days. We had an athlete when I was at Mississippi State that got PRP therapy. We're talking about, back in like 06 or 08 or something like that. And I was amazed by the results that were accomplished by that. How long has PRP therapy really been around?
Yeah, so the early 2000s was about when it started. I was fortunate when I was a medical student to work with one of the first clinics that was doing it, and this is now 10 years later, like early 2010s. But the idea behind it has been around in Europe for much longer, and then coming over to the United States, it's really only gained more mainstream, popularity in probably the past 10 years or so.
Is there any, extra demands or timelines as you're working with? Especially a super high level athlete that has hey, we're going to compete in Paris at the Olympics. Is there certain timelines when they're going to be backed up to do the therapy and so forth?
Good question. And that wouldn't make a difference if you were an Olympian or if you were, I saw somebody the other day who enjoys doing CrossFit, right? And they want to get back to CrossFit. A lot of the literature shows with PRP, whether you use the lower concentration that I mentioned or the higher concentration, your turnaround time for improvement in your discomfort is going to be at about 28 to 30 days. I had a patient tell me that on Monday and told me that she didn't believe me, and then when she came back for follow-up, she said, you were right. And that's not what I'm saying, that's what the literature is supporting. So backing it up before an event, if we have a competition in 2 weeks, I'm going to tell you we can try, but realistically me doing this is not going to make you, high 90%, 100% prior to your event in 2 weeks.
Is there a country that's kind of at the forefront of PRP therapy or regenerative medicine?
Yeah, I think the United States, as far as PRP, does a pretty good job at it. I think realistically, you're looking at like Germany and France. They're going to have a little bit more. There's a guy in Italy who does a ton of research on it too, and they have a little bit more freedom in what they can do legally with some of these products. So their research is not restricted, and those are because of the European Union. You can have a little bit more leeway with kind of experimenting and testing on it.
It always fascinates me with learning, and the more you learn, where do you get some of your kind of thought process from, or where do you learn from?
Yeah, I mean,
you just mentioned Germany and France, and a doctor doing some cutting edge stuff. I know when I was coaching, it was always, where are you going to learn? Who's doing something a little bit different that we could add into it to give us that little bit extra edge?
Yeah, I appreciate this question. It's hard when you have a special interest that not a lot of people know about or talk about. I think collaboration is probably my biggest thing with other sports medicine physicians, and bouncing things off of each other. And this is cool, and so people like talking about it. And then reading, it goes back to what your professors told you and what your high school teachers told you. The more you read, the smarter you'll be, right? So I think reading research papers and reading some of the conversations that people are having, LinkedIn is a great example of that, and talking about problem solving for that.
It's fascinating. Is there a sport, or it could be a sport or an activity that leads to more PRP, that people are more inclined to do PRP therapy?
I had a feeling you were going to ask me this, and I think with our background of knowing each other, track is probably one of the biggest ones.
Wouldn't surprise me.
You have so many overuse type injuries as well as acute injuries. I mean, you'll see some of the same stuff with like basketball and football, but your timeline with track is also a little bit different because you tend to have a little bit more time. So I can play with those plasma products a little bit differently to get us back to a track meet, in a few weeks rather than game on Sunday, kind of thing.
Do you find that athletic trainers or sports medicine doctors are a little apprehensive or a little gun shy to say, hey, you should try this, or are they a little more open-minded?
It's another great question. Of course, apprehension, and I welcome the apprehension. I tell patients you should be apprehensive for anything that you're paying cash for. And I think the younger generation, I consider myself to be part of the younger generation, is more open to things like this, where the older generation of professionals is maybe just because they haven't heard about it or they haven't read about it or they don't know anybody else that's had it. So I think yes, and you should be, especially if you're paying cash. And so seeking out people who do these procedures, seeking out someone with a little bit more, reputation isn't everything, but a little bit more background behind it, I think is important.
Switching from the sports side to the everyday person side, where did those referrals come from? I mean, because you sit there and think, I think of, our sports medicine doctors, different universities I worked at, we're always trying to find the best method. But when you get outside of sports and you get into mom and dad just doing things, who then finds out and refers them to you?
Yeah, word of mouth is probably the biggest thing. And I used to be up in Northwest Arkansas with the University of Arkansas, and I've only been back in Houston for, I think I'll be at 10 months at the end of the month. So I've done, well over 100 procedures since I've been back. And often what I found is, I'll treat a patient for a physician or a surgeon, and then I'll see 2 or 3 more patients from that physician or surgeon within a few weeks. Or I'll treat somebody and it's somebody who, their friend who they play tennis with, or who they run with, or who they play bunco with, or their grandson also had this done. And so that word of mouth and that reputation from that really builds that patient profile, especially if they've had benefit, right? If you didn't have benefit, obviously you wouldn't tell somebody, hey, you should go try that, and I think that would help you.
Has there been somebody that's come the farthest that you could think of? What's the farthest distance somebody said, hey, I heard about this and I'm gonna fly in for it?
So when I was in Northwest Arkansas, I had someone fly in from South Florida, which I thought was weird because they passed so many people to get to me. And since I've been in Houston, I've had a few Olympians fly in from all over the country to come see me. And then I had someone a couple people flying from Mexico, but probably the furthest is from Colombia, since I've been back in Houston, that's come in. And
Wow.
it's because they looked at my profile online and, read about me and then thought like, okay, I want to go talk to this guy. And so with them, they come in, we talk, and then we do the procedure and, we touch base with them, make sure they're getting better.
Fascinating. What an incredible segment. We're going to take a commercial break and we'll be right back with some fascinating insight on regenerative therapy. So stay tuned and we'll be right back.